Hello, everybody. Sorry, I'm a couple minutes late getting here, um, but I was just looking over a couple different things. Um, Hello, Tori. Thank you for joining. Hello, everybody else. That is, thank you. Thank you. I like them too. They replaced my blue ones that broke, unfortunately. Yeah. Hey, Eleanor. I've been well. Been dealing with this resurgent wave of COVID. Just stressed out beyond belief at the hospital. Short-staffed and working our asses off to save countless lives. It doesn't seem to be going that way sometimes. So what I want to talk about was what we're seeing as far as vaccinated versus unvaccinated people, specifically in the ICU. Um, because the majority of people that are vaccinated that do end up getting COVID end up having a much more mild case. Here, I'm gonna adjust my camera just a little bit. There we go. But they end up having a much more mild case. Most don't require hospitalization. Um, but what we are seeing breakthrough cases that do end up in the hospital. Um, but the majority of those people are people that do have severe comorbidities, severely obese, uncontrolled diabetes, hypertension, COPD or emphysema, things like that, where they have chronic illnesses that already put them at a disadvantage for getting a respiratory infection, respiratory illness. Hey, Cosmic, thanks for coming over from Twitch. I appreciate it. It's good to see you. But I think that what we're seeing with the breakthrough cases that are coming through that are ended up in the ICU, like I said, are these people that are that have severe issues, other problems. And they have multiple disease processes going on that prevent them from being able to get over this as easily as somebody else. Your average healthy 20, 30-year-old that is vaccinated is typically not requiring hospitalization. And very few of those people are requiring a stay in an ICU, definitely. Most of them, if they do end up in the hospital, they'll end up on a med-surg floor. Maybe they need some supplemental oxygen for several days, maybe a week or two or something like that, and they're going home. But the ones that we're seeing coming into the hospital that end up in the ICU are 90% or more unvaccinated. And the ones that are dying are 95 to 98% of those that are unvaccinated. We are having those few vaccinated people that do die. And I could probably say pretty assuredly that it's probably 1 in 20 of the people that are dying that are vaccinated. 1 in 20 of the vaccinated people might be dying in our ICU. So thanks Cosmic, I appreciate that. Need something like a nasal spray vax. I don't know that they have. I don't think that nasal spray vaxes don't seem to work very well. I know they tried it with the flu a couple years ago, especially with kids in schools and stuff like that, and they found that it just did not take very well. So I don't know that the nasal spray vaxes, unless they can ensure that they work a little bit better, are the way to go at this point. I think unfortunately, we still need to get people out and get them stuck in the arm, times 2, unfortunately. And according to CDC recommendations, once you hit that 6-month mark, you'll need a booster. But hey, Jason, thanks for coming in. Um, Pfizer has one for pets. COVID actually better than nothing. Well, yeah, that's true. That is better than nothing. Thank you, Kim. I appreciate that. Um, but so what we're seeing is mainly unvaccinated people dying, and I can tell you that a specific case that hit me really hard the other night. This was a young gentleman. Um, he had not been doing well. He was roughly my age, just a couple years older than myself. Has 4 kids at home. That's my exact scenario. Has a wife, 4 kids, a job, contracted COVID, didn't want to get vaccinated, and as the charge nurse that night, I had to call the wife and say, "Hey, your husband's not doing well. He's had a lung that's collapsed. We're calling in a surgeon emergently to come in here and try and place a chest tube so that we can reinflate his lung. But it doesn't look good at this point." And she was like, I don't know what I can do at the moment. I have to find somebody to watch my kids. But within 20 minutes, she was there. She actually beat the physician there. Um, the physician got there, um, attempted to place the chest tube, got the chest tube inserted, but unfortunately, it was too late. Unfortunately, he didn't make it. And I could see the devastation in this woman's face. Even though she's wearing a mask, you can see it in her eyes. You can see the heartache, the despair. And she even told me, she said she's a licensed mental health counselor. She says she deals with tragedy and heartbreak and helping people through stuff all the time. But she says she doesn't know how we as nurses do this day in and day out. Um, and she expressed her gratitude, like sincere gratitude to us, and that meant a lot. And that really hit hard, that particular case. Um, but that was another unvaccinated person, and they're, I don't want to say dropping like flies, but we're having a death, sometimes 2 every day in my small ICU. Um, we don't have room in our morgue. We have a refrigerated truck out back, because all of your funeral home or all of our funeral homes around our area are backlogged. They can't process bodies quick enough. They can't get funerals arranged quick enough. They can't get viewings for families quick enough because they have so many dead bodies. They have um, so many families waiting, to have a service for their loved ones, to bury them, to put them to rest, to have them cremated, whatever it is that they're going to do. Um, yeah, so that's kind of where we're at right now. And I had to take a new nurse down there the other day. She never actually had she's a fairly new nurse. She never actually had a patient pass. And I had to take her down, show her how our, we have a security process of how we um, get a morgue cart, go through security, and all the checks and validations that go along with that. Just the hospital, the paperwork end of it, that's required, just to transport a body down to the morgue. Um, and even she, I mean, she's been a nurse for a couple years, working on I think she worked on an ortho unit prior, but she said she was kind of creeped out by the fact that we're putting bodies in a refrigerated truck. And I remember doing this during the second wave. And to me, it was just like, and now to me, it's like, okay, how we're doing it again. But to somebody that hasn't had to do it, it's like, it's a new experience. And it's like, what are we doing? Why is it like this? And it's like this because there's so much crap out there, and people are taking horse dewormer now to try and cure themselves of COVID at home, uh, and the list goes on. Uh, hey James, how are you doing? Thanks everybody for coming in. I haven't been keeping up with Yes, I do get your point, Cosmic, and there were some places, and I don't know if they were doing it where you are exactly. I'm not going to say where you are. I don't want to out you or anything, but I know there are some places where they were doing door-to-door vaccinations for people. I don't know if that was offered in your area or not, but there are some places that they were doing that um, for a short time. I don't know if they still are or not in places. Um, for the third time you had COVID and you're fully vaccinated, it's been rough. Yeah, I can understand that. Um, yeah, Jason, the hospital capacity is we're beyond capacity at this point. We every night that I've worked in the past 3 weeks, 4 weeks now, we're on what we call critical care bypass, which means that an ambulance cannot bring a critical patient to our hospital because we have no beds. And we've been on volume bypass as well, which means there are no beds for anybody in the hospital. So what that means is the only people that are coming in are people that are driving themselves to the hospital. And if they're there and they need to be admitted, they sit in an ER waiting for hours and hours, sometimes even a day or two before a bed might open up for them to be able to get out of the ER and actually get into a regular hospital room. Now, it's not to say that they're not getting the same care that they would get, but an ER mentality is a lot different than working on a floor. An ER nurse is all about taking care of the emergency. So if it's not an emergency, a lot of times, if you're stuck in an ER, you might feel like you've been abandoned. You might not see a nurse for several hours at a time because they're next door taking care of the patient that's coding, or they're helping assist with some crazy overdosed guy that came in that they have to tie down to a stretcher, just whatever the case may be. So, um, immunocompromised should take the booster whenever they're offered it. Um, I actually am immunocompromised as well, but I reached out to my neurologist the other day. My infusion for my medication is coming up too soon. I have to be a month away from that before I can get my booster dose. So I've got to wait until after I get my infusion at the end of this next month, and then wait a month after that before I can actually get my booster shot. So that's kind of where we are with that's everything that I know about the boosters. Pretty much anybody that if you've had it within, I think there's a cutoff. If it's been within roughly earlier than 6 months, they kind of don't want you to get it. But if you're at that 6 month mark and you are immunocompromised, they definitely want you to be able to get the uh, booster shot or booster vaccine, booster dose, I should say. So. You had somebody come by your door and ask if you were vaccinated the other day, Tori. So I guess they are doing that in your area then too, huh? You haven't heard anything about door to door locally for you, Cosmic. Okay. Yeah, I think the COVID numbers are down in California a little bit. The numbers kind of nationwide have kind of plateaued at this point. We're not seeing the numbers go up dramatically. But if you look at previous waves as well, we saw that as well, where we would see a short plateau for a week or so, and then cases would spike again before we actually reach the true peak. I'm hoping maybe we have reached the true peak. I'm hoping that this wave is not going to last as long as previous waves. That would be great. I would be happy with that. But that doesn't necessarily mean that that's what's going to happen. We have to wait until it's over to see how it went. Unfortunately. Yeah, school has just started. School has started here. We've already gotten an email from my son's classroom that he had a close contact and we needed to watch him. He has not been symptomatic, but he also wears a mask to school. So does my daughter. whereas many of the other students are not wearing masks because masks are not mandated. Because as most of you know, I'm in Florida, and our governor's a dipshit, kind of like a lot of other Republican governors and a lot of other Republican states. They're all dipshits. So, but Israel study on vaccinated people versus people who had COVID and natural immunity. No, I have not seen that particular study, James. Yeah, some doctors' offices are not available to get them for whatever reason. I don't know why. Cosmic, my wife's grandmother's doctor doesn't have it, doesn't have the availability. And I think it's a supply issue or something. I don't know. I don't know why some doctors' offices can have it, some doctors' offices can't. I don't know if it has to do with patient population or patient numbers or what it is. Not sure about that at all, honestly. What if someone is in contact but shows no symptoms because they are asymptomatic? That's always a possibility, Tori. There are people that similar to the people know the story of Typhoid Mary, who spread typhoid to people. She was asymptomatic much of her entire life, but spread it to numerous people. That same can be said for people with flu. Some people just they don't exhibit symptoms of different diseases, and they can spread them. Unfortunately, I think that's the case with just about everything. Yeah, death sentence is particularly evil. You still just be as safe as you can. You wear a mask, you wash your hands, you socially distance whenever possible. Those are the things that you can do. Those are the things that do make a difference. Those are the things that anybody vaccinated or unvaccinated can do. That's an interesting study. I'd like to. I'll try and find that and see what I can come up with. I'll look for that. Yeah, GOP is trying anything that they can do to make Biden look bad. This whole thing with Afghanistan, them telling their constituents not to go out and get vaccinated because then they know that will bring the numbers up, making it look like the vaccines have totally failed. They said to get the booster shot after 8 months, but have changed it to 6 months after the second dose. Which one is it? I have been told both, so I don't know which it is myself, honestly, Desiree. The best thing I would do is contact whoever in your area is administering vaccines and ask the question directly to them. They would be able to give you exact guidance on that. Because I've heard both numbers as well. I don't know which one it is. I know I fall into the category where I can get it myself. So they give you different answers. I don't know then. That's something I'd actually have to look up myself. Yeah, Afghanistan. Biden didn't start Afghanistan. He inherited it from Trump, who inherited it from Obama, who inherited it from his predecessor. This has been going on for 20 years. It has nothing to do with Trump. I mean, with Biden. But Trump did have a hand in it because I'm not even going to go there. I'm not getting all political tonight. But yes, I don't blame Biden at all for Trump or for Afghanistan. So No, Trump emboldened the Taliban is what he did, um, by inviting them to the White House and releasing hundreds and hundreds of their prisoners of theirs that we had. Um, so yeah. Anyway, like I said, I don't really want to go politics on this right now. Um, but yeah, so what I'm seeing, what I'm particularly seeing in my hospital specifically, because that's the only place that I go is my hospital. I go there, I go to work, and I come home. I don't go out. I don't socialize. I don't um, do anything except possibly go to the store. And when I go to a store, I wear a mask. And when I am out in public anywhere, I'm wearing a mask because even as a vaccinated person, I still don't want to catch this. I still don't want to end up in a hospital. One of our nurses currently is out with COVID. Um, she had one of her sons came home, close contact, got sick, gave it to her. Now she and her entire family are out with COVID. Last I had heard from somebody, she's doing well, but had been feeling like real crap the last couple days, but not to the point where she felt she needed to come into the hospital. She does have her pulse oximeter. She's still sitting in the high 90s, 97, 98. So she's not worried about having to come to the hospital yet, but hopefully it stays that way for her and for her children. She's got 4 young boys at home. But I have another nurse. I know another nurse that we had COVID back last year. Got vaccinated, had COVID again several months ago. She did say that having it the second time was not as worse as the first time. She said she attributes that to both having had gotten over COVID naturally and also having had the vaccine. She's back at work now, thankfully. And we had one other nurse that recently was out with COVID on my shift as well. So we've had several people that have contracted it. Luckily, none of them have gotten really sick. But we have had several nurses at my hospital that have gotten COVID, that have, one is at a point now where she will never work again. She is at home. She gets winded taking a shower. She can't even um, take off her oxygen for more than a minute or two at a time, just to blow her nose, because it winds her too much. She can't get um, she can't get up and out and hardly walk to her mailbox. That puts her out. She said, she told somebody that um, taking a shower is like something that she does once every couple days because when she takes a shower, she's done for the day. That's it. She's out of energy because it winds her so much. So much. It makes her so tired. It depletes all reserves that she has. So that's somebody that's dealing with the effects of what we call long COVID, the long-term effects, and we will be seeing this for a many number of years coming down the road. It's going to be as we stay in healthcare, myself and many other nurses, that's going to be a something on there, somebody's health history, history of COVID pneumonia, and we will know what that means. And another nurse that I spoke to, older nurse, much older nurse, much older than myself, um, has been a nurse since became a nurse back in the 80s. She is past retirement age at this point, but continues to work because she said she'd be bored at home. But she says she remembers working through the AIDS pandemic, and it was uh, very similar, high anxiety, high stress as this, but it wasn't the same. She goes, "This is different." She said, "But the thing is, once they figured everything out, once they finally were able to get therapies that worked, once they were able to finally get medications, I mean, now people live with AIDS like it's nothing. There are people that have had AIDS for 20 years and they don't even know it, and they get tested and they don't even test positive because the medications that they have keep the disease so under control that it's not even detectable by our tests now. Um, so the in another half dozen years or dozen years from now, hopefully, COVID will kind of be that way. We will have very good, very specific treatments, better vaccines. Because I'm not even saying that the vaccines that we have now are the best. Anything can always be made better. New medications are always coming out. New classes of medications are being developed that replace previous generations of drugs. Uh, some drugs have a whole lot of side effects. The company comes out with a new one that has fewer side effects. More people want to take that. You don't want to take a drug with 20 side effects. You want to take the one with 10 or with 5. So I think that as we go through this and as time passes, COVID is going to be the new AIDS. It's going to be the new HIV. Um, it is going to be something that eventually we will be able to control. But it could have been much better from the beginning had the pandemic been handled um, in a much better way here in the United States. Had we had strict mass mandates and curfews and things like that from the beginning, we wouldn't have over 600,000 people dead. Maybe we would have 100,000, 200,000, but um, it wouldn't be as high as it is now. I think if this had been controlled better. So sorry, I've kind of been not paying attention to the chat. Is it safe for vaccinated to eat in a restaurant? It depends on if the restaurant is socially distancing. But me personally, I still really don't want to go out and eat in a restaurant. Um, just because the ventilation system can pass COVID around from, even if you're socially distanced, even if they put the tables 10 feet apart from each other, just the air conditioning system or fans in there can blow COVID around in a restaurant. It takes one person coughing. Delta variant is much more contagious than any previous variant. That's why it spreads so quickly and so fast and hits so many people so hard, because it is very easily transmissible. So I would be leery of eating in a restaurant, shell lady, myself, honestly. Wondering after vaccinated, do they show evidence? Yeah, there are certain markers that we can check for immune response. There are certain markers that we check for immunity, different IgG, IgM markers. That's how um, CDC guidelines right now tell us that if a patient has been hospitalized and they have been there for 20 days, their IgG and IgM are both positive, and they have not had fever in the last 7 days, we're actually allowed to lift COVID isolation off those patients. And we do that quite often at this point because they're no longer considered contagious. Um, so some people, I don't know that some people are not developing sufficient immunity, but I think that different variants are probably able to come back and hit people differently. That is my best guess at that. All of the variants are not 100% protected. None of the variants are 100% protected against the vaccine. There's still going to be those breakthrough cases. There's still going to be those, even if you have even if you have a vaccine that's 99.9% effective, there's still that 0.1% that is not effective. And none of the COVID vaccines are nowhere near that high. And against some of the newer strains like Delta, it's even lower than what they had initially said for the original variants. And some of the preliminary data coming out against the Lambda variant are showing that the COVID vaccines are even less effective against the Lambda variant, which I still have not had time to do a lot of research on myself. But that is one thing that I have seen in highlights. Yeah, I think that Jason, I think that several companies are working on some type of an outpatient prescription. Right now, one of the few options for people with mild to moderate COVID is to go into a hospital or an infusion center. There are many set up across my area, and I'm sure there are in many other states to get monoclonal antibody treatments. That is one of the best treatments that they're giving right now, most effective for people with uh, mild to moderate COVID, fortunately. Yeah, I think that one day, like I was saying, Jason, one day we'll get there. We're just a ways off from it still. I think they still have a lot of research to do, a lot of things to figure out. And one of the things too is viruses are very, very hard to combat because viruses mutate quickly. That's why the flu comes around every year. It's a little bit different every year. That's why the common cold comes around every year, sometimes 2 or 3 times a year, depending on where you live, because it mutates so quickly and changes. And what you're immune to by having the cold 6 months ago is not the immunity you need to prevent you from having the cold now when you encounter it. So eat outdoors at a restaurant. Yeah, I typically just go pick up stuff. I will go in, wait at the like curbside pickup and have them bring it out to me. That's what I typically do if I'm getting dinner, and just bring it back to the house. Because for one, I don't want to take my entire family out and expose everybody to COVID. Um, my older children will wear a mask, but I can't get my 4-year-old to keep one on unless I'm watching him directly. I have taken him out just to like run up to the corner to get something real quick, and I'll make him put a mask on just to go into the store. He'll keep it on for a couple of minutes, but any extended amount of time, it's hard to keep a 4-year-old in a mask or somebody younger than that in a mask. So Gold's Gym tells you no mask. Well, I'm not going to a gym, so but I'm fat and out of shape, so Delta can spread in 3 to 5 seconds. That's probably about true. I mean, if you think about how, if James, go on YouTube and just look up coughing and sneezing, like under black light, and look at how far. You'll be surprised how far a cough or a sneeze or something like that spreads. And when a cough or a sneeze is that forceful, it can actually aerosolize the saliva, and the bacteria on that saliva can just stay suspended in the air. So it's not even about the fact that somebody walks through just as you sneeze or cough. It's the fact that they walk through that area 10, 15 seconds after you sneeze or cough. If those particles are still suspended in the air in that area, um, if you were infected and you sneezed and coughed in that area, then now that area is infected for a certain amount of time until the air cleans out, until it thins out enough that those particles are dispersed far enough where it's not going to be enough of a viral load to give somebody COVID. I don't specifically say the hospital I work at. I don't talk about my actual employer. So I will say that I am in the Tampa area, not in Tampa itself, in Florida. So the COVID, yeah, Delta or surgical masks, yeah, they're still good against COVID, all the variants. But the thing is, both people, everybody needs to be wearing them, not just one person. I mean, if you're the only one wearing a mask, yes, you're protecting yourself. But still, those particles are actually small enough to get through the mask. The whole point of wearing the mask is if somebody is wearing the mask, sneezes or coughs, and they are COVID positive, those particles don't have enough distance to get out to get aerosolized. They get trapped in the mask. So you're not getting exposed to them. Their mask is kind of keeping their viral load with them, if that makes sense. I think we're a little bit better off in Florida now than where New York was when they first got hit, only because they did not know anything at the time. We at least have a year and a half of research at this point. We do know what treatments work. We do have some medications that help. We don't have a miracle drug that fixes this yet, though. Even some of the best drugs that we are giving, like remdesivir, are only shown to decrease the length of COVID, not necessarily stop it or kill it. We don't have a drug that does that yet. We don't have a drug that goes in and it specifically attacks the virus itself. Hopefully, we will get there someday. Thoughts about mail and package deliveries. I will say that since COVID, Cosmic, we get a lot more deliveries. Um, Most of my stuff, um, I leave it outside. Um, my neighborhood is very secure. I live in a gated community. Nobody comes, anybody, and I'm in the very back of my gated community. Anybody that's back this far in my community belongs back here. Um, so typically, I leave my stuff out, and my front porch gets direct sunlight during the day. So anything that's out there kind of gets blasted by the sun for several hours. So typically, I'll go from there to the garage, open up whatever it is, dump the packages out, and throw the boxes or packaging away out in the garage. That's how I do it nowadays. So double duty now here. Can't stop lunch. Okay. All right, Cosmic. Thanks. Um, there's some more research out about fomite transmission of COVID. It's not as prevalent while it can live on certain substances, certain surfaces, not substances, certain surfaces for certain amounts of time. Um, Floors, walls, public spaces, things like that, stuff you touch out in public, even handrails, door handles, things like that. If you are sanitizing your hands, if you're washing your hands on a regular basis, those types of things are not things that you need to worry about too much. I would not go out and walk into a gas station, open the door handle, and then lick the palm of your hand. Um, but I wouldn't worry about walking into a gas station, paying for something, going back out to my car, and getting my hand sanitizer out. There's a big difference. Um, the fomite or surface contamination of the viral particles has been shown to be a very small portion of contracted cases. Most are people that are breathing the same air as somebody else that's infected, being around somebody that's coughing or sneezing, or being in large groups of people where the probability is high that somebody has had a positive case there in that crowd. So those are the types of things that you really need to worry about. Fomite transmission, like I said, surfaces, even gas nozzles and things like that are not high sources of transmission. Um, and yeah, like Diane's saying, you can wear gloves to pump. And actually, I've seen some of my local gas stations actually have put glove boxes out at the pumps for people to use gloves to pump with, which is a good thing. And if you have that ability or you have access to gloves, I mean, it's one extra way to be a little bit safer. But I do caution people in the wearing of gloves because I've seen so many people do it wrong, especially in the beginning of the pandemic when everybody was out at your grocery store wearing masks and gloves, and they're wearing the gloves, but they're touching everything. They're touching their cell phone. They're holding their gloved phone up to their face like this after they've touched every surface in this place. Um, the thing is, if you're going to wear the glove, you wear the glove, you take it off, you throw it away. That's it. It's the same thing I do in the hospital when I'm taking care of a patient. If I'm taking care of a patient, I have to turn them over and they have a wound or a dressing that I have to change. Um, I get them all cleaned up, get them ready to do that, turn them so that I can get positioned to do their dressing change or wound change or whatever it is. Take off those dirty gloves because now they're technically dirty because I've touched everything else in that room, and don a new pair of gloves to do that procedure or to do that task. So I'm not cross contaminating everything in that room with this patient's wound or surgical incision or whatever the case may be. That's just a nursing thing. Uh, as Cosmic can tell you, that's something that's ingrained into nurses. Um, it's just something that we do. We change our gloves a lot. So your teacher headed back into that classroom tomorrow, Diane. Well, is your district allowing you to wear a mask, or are they telling you that you cannot wear a mask? Because in some districts, we're even telling teachers that they're not allowed to wear masks in the classroom. The safest thing to do is, I would say, it's mandated in your state. Okay, well, at least that. What state are you in? Because you're not in Florida. I can tell you that right now. New York. Okay, well, that makes sense, of course. But yeah, just be safe. Hopefully, I know the vaccination rate in New York is also better than it is here. I was just looking at that earlier on another website that I follow. I think the vaccination rate is up in the 60%, 60 some odd percent in New York State right now for both vaccinations. Yeah, exactly. Well, I think a lot of that has to do with the leadership at the state capitol, unfortunately, Kim Chi as well. When you have somebody like Ron DeSantis who wants to kiss Trump's ass every chance he gets in the GOP, this is where we end up. And any of you that might follow me on Twitter, you might have seen a couple of my posts recently. I seem to be a little bit more jaded in some of my posts. That's kind of because I am at this point, because I'm fed up. I'm tired of this. I'm tired of COVID. I'm tired of dealing with this. And it's not just this wave. It's the last year and a half of all of this in culmination. It's the fact that at one point I knew how many people we had die on my small COVID unit or on my small ICU at the beginning of this pandemic. Now I can't tell you how many people died last week. Because I know just in one day it was 2 on our unit, and we only have 12 beds. We only have the ability to expand up to 24 if we need to, because we can take over our step down unit, which we have been doing. We've been expanding up to 18, 19 ICU patients. And out of those 18, 19 ICU patients, 16 to 17 of them are COVID. 1 or 2 of them might come in with another issue. And that's the other problem that we're seeing too is delay in care, delay in treatment for people that are coming in with non-COVID emergent related medical problems. Is an issue. It's a problem. We don't have nearly as many beds available for these people that are coming in. People are coming in with a heart attack or just a COPD exacerbation or uncontrolled chest pain that they don't know the origin of. Might not necessarily be a heart attack. Maybe they're just having angina, or they're having um, severe acid reflux, which they're thinking is a heart attack, and they're actually just have a really, really bad case of GERD that's never been diagnosed. Those types of people that we can't um, get to as quickly because all of our time is taken up with COVID. All of our time is taken up with donning and doffing PPE 10, 12, 14 times um, in a shift just for one patient. Um, and if you have 2 or 3 COVID patients, you multiply that by how many COVID patients you have. And all of that takes time. And all of that time spent doing that takes time away from other nursing tasks that we have to do, like actually taking care of the patient, actually being there in the room, actually um, being able to thoroughly assess the patient over and over again to look for subtle changes that can sometimes easily get missed if you're in a hurry, if you're rushed, if you're short staffed, if you don't have the help that you need to be able to do those things as effectively because you're rushing, because you know you have to get out of this room because next door your critical patient needs more attention. Uh, those are the types of things that those are the types of stresses that COVID has put on nurses. So, so thank you everybody for coming in. I wasn't paying attention to the chat again for a little bit. I think that the official numbers are skewed to an extent, Kim, because if you go back and look at some of the earliest numbers that were coming out of New York when the first wave hit, when New York was hit really hard and people were dying and dying and dying and dying, when we really had no idea how to combat this, um, there was a record number of deaths that um, were over and above beyond normal home deaths for that time, just people dying at home. So those numbers, while they were probably never diagnosed posthumously with COVID, are probably technically COVID deaths, along with a lot of other deaths. Um, and I think that sometimes um, some things may get mislabeled because I believe that depending on who's reporting it, where it's getting reported from as well, um, what was it that killed somebody? What is it that's put on the death certificate a lot of times? What is it? Where are those numbers going? Who's recording it? I think that the number, I don't think we'll ever know the total true numbers. Uh, and that goes with everything. That goes with anything. I mean, there's part of it's human error because if I go into the hospital and I have COVID and I die and I go into cardiac arrest, what technically killed me technically was the cardiac arrest. What put me into cardiac arrest was the COVID uh, because of blood clotting issues or things like that. But depending on how somebody writes my death down, even though I was a COVID positive patient, if they write it down as he died of a cardiac arrest, I'm no longer a COVID death. Does that make sense? Sorry, I'm trying to go back through comments here. Yeah. Oh, what was her name? The girl that was fired that was reporting all of the. She was running the COVID dashboard. Kimberly. I want to say Parks, but I don't think that's it. I'd have to look her up real quick. But yeah, in Florida, yeah, the numbers in Florida have definitely been skewed. They were actually forcing doctors at one point, and that became a scandal for a hot minute in the news. They're forcing doctors to put down different causes of death, even though the doctors said, no, this person died of COVID. It takes 12% of voters of recall governor if he wants to replace Senator Prince. If California governor would affect the ratio of the Senate. Yeah, that definitely would. I hope that the recall just goes nowhere. Because honestly, I think the recall in California is a crock of shit. I think the last person that should have been recalled was probably Trump about 2016. That would have been great. And we would not be here, and I probably wouldn't even be broadcasting. I might not even be on Twitter if that were the case. um, James, if you're not going to be nice, just go. All right. Jason's actually a friend of mine, and I don't appreciate it. Yeah, you definitely we definitely don't need another RBG situation. I feel you. So, well, unfortunately, HAPS does not allow me to moderate like um, Periscope used to. So let's just part ways and be nice. How about that? But anyway, so I just got done reading through the comments. I do want to say thank you for everybody who came in, everybody listened. I'm coming up on close to an hour now. I did not expect to actually be on this long. I appreciate you all. Um, I can appoint mods on YouTube. Yeah, but how many people are actually viewing from YouTube? I think that most everybody is actually on apps at this point. And I don't even know how to make moderators on either one of those platforms. I only made the accounts just to be able to simulcast to them. Cosmic. I'd have to like figure all that stuff out. But then you can't moderate here. That's the thing. That's where I want. I would like HAPS to actually introduce the ability to be able to moderate within HAPS itself, uh, even cross-platform, because it's their feed that they're showing. Uh, but anyway, all right. So anyway, yes, vaccinated versus unvaccinated deaths. More people unvaccinated are dying. Like I said, I can count 1 in 20 of the vaccinated people that I can recall that have actually died. And that was somebody that had some very, very serious health issues. I will not go into specifics just for privacy reasons. I will just say they had very severe health history that prevented them, unfortunately, from being able to recover. And some of the people that are still even recovering, they're not recovering and going back to a normal life. People that even unvaccinated people that are recovering, um, they're not recovering and going back to a normal life. Like that nurse I was telling you about earlier, that she said she gets winded now just by taking a shower, and that puts her out for the day. Um, she would have loved to have get the vaccine. She contracted COVID back before the vaccine was a thing. back before they had announcements that they were close to vaccines, is back when she went through COVID. So this is over a year ago that she had contracted COVID, unfortunately. And then there are people out there that are taking horse dewormer now because it's been around for 40 years. That is true. Ivermectin has been around for 40 years to deworm your horse. I will say that. That's about the only thing I can say. That's about the only reason it's around. So anyway, I do want to say thank you for everybody coming in. I will say get your vaccine if you haven't had it. Wear a mask, socially distance, wash your hands, and just stay safe out there. There are still things that you can do to keep yourself safe. There are still things that you can do to prevent yourself from contracting this disease, because it's not a path that I would wish anybody to go down. I've watched too many people die from this, and honestly, I'm over it. I'm done. I'm tired. I am worn out, and so are many others of us. There are a lot of us that are really just fed up with this. So, like I said, wear a mask, do your best to socially distance, wash your hands, get your vaccine if you haven't gotten it. If you are one of the people that are available to get a booster, I recommend you get your booster. Coordinate that with your doctor. Go by whatever advice they tell you as well. As far as, thank you, James, I appreciate that. But yes, whatever you get as far as advice from your doctors, follow that advice. I forget what it is. I think 98% of all doctors in the United States are vaccinated. Your Facebook friends aren't always vaccinated. I would rather go to a doctor than a Facebook friend for medical advice any day. So, but anyway, I digress. Everybody take care. Well, thanks again, James. I appreciate that. Peace. Everybody, be safe. Take care. I am going to head out of here. You all have a good evening.